Welcome to the deep dive. Today we're tackling something pretty fundamental, really, to how we think about health and safety. What actually makes a substance toxic?
Right. It seems simple on the surface, but it rarely is.
Yeah, and you've shared some fantastic sources with us, covering everything from how you'd initially evaluate someone who might be poisoned
The initial assessment?
to the really intricate ways toxins can damage specific organs, these patterns called toxicological syndrome.
The toxidromes, yeah. Very useful clinically.
And even how things like, well, your age or just the environment around you can completely change the outcome.
Absolutely. Those modifying factors are critical.
So our mission in this deep dive really is to get past that basic idea of poison and pull out the crucial insights. We want to give you a richer, more, nuanced picture of why the same thing can hit different people so differently.
Exactly. It's a fascinating puzzle where, like you said, simple ideas branch out into layers and layers of complexity. Your sources really show how whether something acts as a toxin and how bad it is depends on this whole web of interconnected factors.
Okay, so maybe let's start with the classic idea about toxicity, something a lot of us might have heard.
You mean Paracelsus?
Yeah,
Okay.
exactly. Back in the 16th century, he famously said, and I'll probably butcher the German, alle Dinge sind Gift.
Und nichts ist ohne Gift. Allein die Dosis macht, dass ein Ding kein Gift ist.
Right. All things are poison and nothing is without poison. The dose alone makes that a thing is no poison. And it feels kind of right, doesn't it? Intuitively.
It does, and it holds a really fundamental
Good.
truth. The amount, the dose is definitely a primary factor, no question.
Yeah.
But what your sources really drive home are all the other critical pieces that the simple dose idea doesn't quite capture. It's not just about how much, it's about a whole lot more.
Okay, this is where it gets really interesting, I think. Let's start with the substance itself, the toxic thing. We know dose matters, but what else about the substance plays a big part in how harmful it can be?
Well, a key starting point is the route of absorption, how it gets into your body.
Okay, like swallowing versus injecting?
Exactly.
Yeah.
Think about it if something goes straight into your bloodstream, intravenously, say.
Uh-huh.
It basically bypasses a lot of the body's first lines of defense, like the digestive system. So the impact is much faster, potentially much more severe, compared to taking it orally, where it has to get absorbed through the gut first.
That makes total sense. It's like a shortcut versus the scenic route, but with way higher stakes.
Precisely. The entry point matters a lot.
What about how fast you encounter it? Does that make a difference?
Oh, definitely. The speed of administration is another critical factor.
How so?
Well, imagine your body's detoxification systems. Your liver, your kidneys, they have a certain capacity, right? If you flood them with a large amount of something really quickly, you can just overwhelm those systems much more easily than if the same total amount was given slowly over time.
Like pouring water too fast into a glass, it just spills over.
That's a great analogy, actually. A slow drip might be manageable, but a sudden gush can be, well, disastrous.
Okay. And I guess the concentration must be a big one, too. How much toxin is packed into a certain amount?
Absolutely. Concentration is key. A highly concentrated form means you're getting more of the toxic agent with each bit of exposure compared to something more diluted. Naturally increases the risk.
And the sources also mention chemical composition. It's not always just one bad chemical doing the damage, is it?
That's a really vital point. Often the harmful substance is mixed with other things, solvents maybe, or additives.
Right.
And these other components can interact. They might make the main toxin more toxic, or sometimes less, or they could even cause their own toxic effects. It's not always just one culprit.
Huh. So you have to consider the whole package?
Exactly. And then you get into the physicochemical properties, which sounds a bit technical, I know.
Yeah, break that down for us. What does that mean in practical terms?
Okay, so these are things like the substance's pH. Is it acidic or alkaline? That affects how easily it's absorbed and how much it might irritate or burn tissues.
Okay.
Or vapor pressure. That's super important for stuff you might inhale. Higher vapor pressure means it evaporates more easily, so more gets into the air you breathe.
Right. Makes sense for inhaled poisons.
And then there's ionization, basically, whether the molecule will have an electrical charge. This can determine if it can even get through cell membranes. Think of it like a key. The charge might determine if it fits the lock on our cells.
So its physical state and electrical charge dictate how it moves around inside us.
Precisely. And even small changes within the chemical structure itself, forming new bonds, or creating things called free radicals, or complexes that can drastically change how toxic something is, sometimes making it way worse.
Wow. Okay, so we've looked at the substance side of things. But as you said, The sources really hammer home how differently people react. What are the individual factors? What makes one person more vulnerable than another?
Now we get into the real variability. And age is probably the most obvious example.
Yeah, that seems intuitive. A baby versus an adult or an older person.
Right. The extremes of age, childhood and old age, are times when the body is either still developing or starting to experience some functional decline. Both affect how we handle toxins.
So children first. What are the key issues there?
Well, their organ systems are still immature. Their liver might have fewer enzymes to break down toxins. Their kidneys might not filter as effectively yet.
Okay.
Plus, their digestive system works differently. Slower gastric emptying sometimes, which can actually mean more time for certain toxins to be absorbed.
Oh, interesting. Counterintuitive.
Yeah, and of course, they just have lower body mass. So the same absolute amount of a substance ends up being a higher concentration in their smaller system.
Right, smaller container, higher concentration. Makes sense. And what about the elderly? What changes at the other end of the spectrum?
With older adults,
Yeah.
you often see a different set of challenges.
Yeah.
There's generally reduced enzyme activity, so metabolism slows down,
Okay.
and often a gradual decline in the function of key organs, heart, kidneys, liver. The immune system might not be as robust.
Mm-hmm.
Even the digestive system changes the gut. Motility might decrease, affecting absorption again, and body composition shifts too.
How so?
Typically, more fat tissue relative to muscle and less total body water. All of this changes how toxins are distributed in the body and how long they might stick around.
So, unique vulnerability is at both ends of life, just different reasons.
Oh.
The sources also mention sex as a factor.
Yes, a classic example is alcohol tolerance.
Right. Women generally have lower tolerance. Is that just body size?
Not entirely. Women typically have less of a specific enzyme in the stomach, alcohol dehydrogenase, which starts breaking down alcohol right away. So less breakdown in the stomach means proportionally more alcohol gets into the bloodstream compared to a man of similar size drinking the same amount.
That's a clear biological difference.
Yeah.
Interesting. What about something like nutritional status? Does what we eat matter?
It absolutely can. For instance, if someone's diet is low in protein, they might have lower levels of albumin in their blood.
And albumin does what?
Albumin is a protein that binds to many drugs and toxins. If there's less albumin, more of the toxin stays free and active in the bloodstream, potentially making it more potent.
Okay.
Conversely, your sources mention that eating fatty foods can actually boost the absorption of certain pesticides that dissolve well in fat.
Wow. So your meal could actually affect how much pesticide gets into your system.
Potentially, yes. So nutrition definitely plays a role.
And I imagine pre-existing health conditions are a huge factor.
Absolutely crucial. Think about renal insufficiency kidney problems. If your kidneys aren't clearing waste properly, toxins that are normally eliminated that way can build up. Same with hepatic insufficiency liver problems. The liver is the main site for metabolizing or breaking down many toxins. If it's compromised, it can't do its job effectively.
So someone with kidney or liver disease could be way more sensitive to something that a healthy person handles easily.
Exactly. It really highlights how our baseline health dramatically influences our response.
Okay, let's shift gears a bit to something I hadn't really thought much about in this context.
Yeah.
Environmental factors. How does our surrounding environment play into toxicity?
Yeah, these are often overlooked but can be significant. Take temperature.
Heat or cold?
Higher ambient temperature can actually speed up chemical reactions in the body, potentially making a toxin act faster or more intensely.
Ah.
Plus, when it's hot, the blood vessels in your skin dilate to help you cool off, right?
Right.
Well, that increased blood flow to the skin could potentially increase the absorption of substances through the skin.
So the same exposure could genuinely be worse on a hot day.
It's possible, yes.
Mm-hmm.
And then there's atmospheric pressure.
Really? How does that factor in?
Higher pressure can also affect reaction rates. The sources give this interesting example about alcohol.
Yeah.
Apparently, the effects might feel stronger if you drink at a high altitude and then come down to a lower altitude, potentially because the change in pressure affects how your body processes it.
That's wild. Altitude affecting how drunk you feel later.
It's a complex interaction.
Yeah.
And things like wind and rain obviously influence airborne toxins.
Right. Wind could spread it out or carry it somewhere else.
Exactly. Spread it out, reducing concentration locally maybe, but exposing a wider area. Rain can wash things out of the air.
And deposit them on the ground or in water.
Precisely. Changing the route of exposure potentially.
Okay, so we've got the substance, the person, the environment. Now, the sources shift towards how doctors actually approach someone who might be poisoned. It sounds like knowing all these modifying factors we've just discussed is crucial for that initial assessment.
Absolutely paramount. As your sources stress, understanding this variability helps clinicians get a much better handle on the situation, gauge the potential severity, and decide on the right course of action.
And that initial assessment involves a few key steps, yeah.
Generally, yes. Three main parts. First is anamnesis. That's the clinical interview.
Asking questions, basically. What, when, how much?
Exactly. Getting the history of the exposure. Second is a thorough basic physical examination looking for vital signs, specific clues on the patient's body. And third, often complementary tests. Blood tests, urine tests, maybe specific toxicology screens to identify the substance and see how organs are functioning.
Okay. And after gathering that initial info, the sources talk about toxicological syndromes or toxidromes. What's the idea there?
Think of toxidromes as like specific collections of signs and symptoms that tend to cluster together with exposure to certain classes of toxins.
So patterns.
Exactly, patterns. Your sources list several key ones. Sympathomimetic, think stimulants like cocaine or amphetamines.
Yep.
Cholinergic and anticholinergic, which involve the nervous system's control over things like heart rate, sweating, pupils.
Right.
Serotoninergic, from drugs affecting serotonin. Opioid, obviously from narcotics. Hypnotic sedative, from things like sleeping pills or benzodiazepines. And hallucinatory.
And recognizing one of these patterns helps how?
It's like a diagnostic shortcut. If a patient presents with a clear anticholinergic toxidrome, for example, dry skin, flushed, big pupils, confusion, the clinician can quickly narrow down the list of likely culprits and start treatment much faster, even before getting specific lab results back.
That makes a ton of sense. Pattern recognition points you in the right direction quickly. Now, the sources also go into how different toxins tend to affect specific organs. That must give even more clues, right?
It does, absolutely. Different toxins often have sort of preferred targets in the body based on how they work or how they're processed. Understanding these organ-specific effects is vital for diagnosis and managing the damage.
Let's start with the liver. Seems like it's often in the firing line.
It really is. The liver is the body's main chemical processing plant, so it sees a lot of foreign substances. Your sources make a good distinction between direct liver toxicity.
Like predictable damage.
Yes, often dose-dependent. Paracetamol, acetaminophen overdose is a classic example, or certain mushroom poisons like amanita. You take enough, you expect liver damage.
Okay.
And then there's indirect toxicity, which is more unpredictable. It might be an idiosyncratic reaction, just that one person reacts badly, or a hypersensitivity, like an allergic type response in the liver.
And are some people more prone to liver damage from toxins?
Yes, several predisposing factors are mentioned. Older age, being female for some types of injury, pregnancy, already having liver disease, being malnourished, chronic alcohol use, obesity. These can all increase susceptibility.
Okay. Moving on to the kidneys. How do toxins mess with them?
Renal toxicology is also complex. Toxins can hurt the kidneys in several ways. They might reduce blood flow to the kidneys, cause direct damage to the kidney cells themselves, trigger hypersensitivity reactions within the kidney, or even cause problems after the kidney, like certain drugs forming crystals that block the tiny tubes.
Wow.
And the sources mention specific types of kidney tubule problems linked to certain toxins. Fanconi syndrome with cadmium, renal tubular acidosis with amphotericin B, and a type of diabetes insipidus, basically making you pee constantly, with lithium.
So, again, different attack strategies leading to various kidney issues. What about the nervous system? That feels like another major target.
Critically important. Neurotoxicity. This can happen directly, where the toxin or its byproducts interfere right with nerve cells.
Right.
Or indirectly. The result can be something called toxic encephalopathy, basically. Brain dysfunction caused by the toxin.
And what does that look like?
It can manifest in lots of ways.
Yeah.
Altered consciousness, confusion, memory problems, seizures, hallucinations. Think of substances like alcohol, many psychotropic drugs, heavy metals like lead or mercury, carbon monoxide. Even low blood sugar, hypoglycemia, can cause similar symptoms indirectly. And the sources also specifically call out toxic seizures and toxic stroke as very serious potential neurological outcomes from certain poisonings.
Scary stuff directly impacting the brain. What about our blood? Can toxins affect blood cells?
Yep, that's hematological toxicity. Toxins can hit the bone marrow where blood cells are made.
Yeah.
This can lead to things like aplastic anemia, where you start making enough blood cells seen with benzene or certain drugs.
Okay.
They can attack red blood cells directly, causing them to burst. That's hemolysis. This can be worse if someone has an underlying condition like G6PD deficiency.
Right.
Or they can cause abnormal hemoglobins to form, like methemoglobin or carboxyhemoglobin, which can't carry oxygen properly. Think carbon monoxide poisoning for carboxyhemoglobin.
Mm-hmm.
Toxins can also knock down white blood cell counts, like neutrophils needed to fight infection, common with chemotherapy, but also some other drugs. And they can affect platelets, reducing blood clotting ability, thrombocytopenia.
It's really striking how many different ways toxins can disrupt us system by system. And finally, the sources briefly mention the respiratory and cardiovascular systems.
Yeah, obviously crucial for immediate life support in poisoning cases. Respiratory toxicity can lead to failure through many routes. Not enough oxygen coming in, breathing effort being suppressed, hypoventilation, airways getting blocked, lungs stiffening up, gas exchange being impaired, or oxygen not being transported properly in the blood.
Lots of ways breathing can go wrong.
And cardiovascular toxicity can cause low blood pressure, hypotension, high blood pressure, hypertension, dangerous heart rhythms, arrhythmias, shock, and ultimately cardiac arrest.
It really drives home how one exposure can spiral into life-threatening emergencies. All right, let's focus now on some specific populations our sources highlight as being particularly vulnerable, starting with reproductive and perinatal toxicology.
Yes, this is a really sensitive area because you're worried about both the mother and the developing fetus. Pregnancy itself causes major physiological changes.
Right. How do those changes affect toxin handling?
Well, absorption can change. Gut motility slows, which might affect things taken orally. Breathing volume increases, potentially affecting inhaled substances. Blood flow changes can impact skin or intramuscular absorption.
Okay.
Distribution changes too. Total body water goes up. Protein binding in the blood changes. And critically, there's placental transfer.
The toxin getting across to the baby.
Exactly. While the placenta is a barrier for some things, many toxins can cross it. And there's an interesting phenomenon called fetal ion trapping.
What's that?
The fetus's blood is slightly more acidic than the mother's. This can cause certain types of substances, particularly basic ones, to get sort of trapped and concentrated on the fetal side once they cross the placenta.
Wow, so the baby could end up with a higher concentration?
In some cases, yes. It adds another layer of vulnerability.
And we absolutely have to talk about teratogenic substances, the ones that cause birth defects.
Yes, teratogens. These are substances that can cause structural or functional problems in the developing embryo or fetus. The sources list several known ones. Alcohol, certain medications like folic acid antagonists, lithium, retinoids, thalidomide.
Infamous one.
Indeed. Also cocaine, some pesticides, warfarin. The risk often depends on the dose, and crucially, the timing of exposure during pregnancy, because different organs develop at different times.
Such a critical reason to be incredibly careful about exposures during pregnancy. Now let's swing back to geriatric toxicology. We talked about some age-related changes earlier, but how do they specifically play out with toxins in older adults?
Right, so in older adults, you see changes in both pharmacokinetics, what the body does to the drug.
Absorption, metabolism, etc.
Exactly, and pharmacodynamics, what the drug does to the body. Absorption from the gut might be slower. Distribution changes because of shifts in body fat, muscle, and water content, plus changes in blood proteins. Metabolism in the liver often slows down, less blood flow, fewer active enzymes. And excretion by the kidneys usually declines too, as kidney function tends to decrease with age.
So basically, older bodies might process and clear toxins more slowly.
That's the general picture, yes. This can mean the toxin hangs around longer or reaches higher levels, increasing the risk of side effects or toxicity, even at standard doses. And your sources rightly emphasize two other big factors in the elderly. Huge individual variation age isn't just a number. People age differently, and polypharmacy.
Taking multiple medications at once.
Exactly, which dramatically increases the chances of drug interactions, some of which can be toxic.
It really paints that picture of heightened vulnerability again, just for different reasons than in kids. Now, finally, the sources mention a really practical resource, the Toxicology Information Service. What is that exactly?
In Spain, it's the National Toxicology Information Service, SIT. It's essentially a 247 hotline staffed by medical toxicologists.
Okay. Who can call?
Both healthcare professionals and the general public. They have massive databases on toxins and provide expert advice on diagnosis, treatment, management. Basically, what to do in a poisoning situation. It's an invaluable resource.
So if a doctor or even just a concerned parent has a question about a potential poisoning, they can call this number.
Precisely.
Yeah.
And they do more than just answer urgent calls. They track poisoning data, consult with institutions on things like workplace safety, do educational outreach, support emergency responders during chemical incidents, and even assist with forensic toxicology.
Sounds incredibly comprehensive and essential. Are there specific numbers people should know for emergencies?
Yes, for the general public needing urgent advice, the number in Madrid is 91-562-0420. The Barcelona number is 93-317-400.
Okay.
And there's a separate line specifically for healthcare professionals, 91411-T676. They're also linked directly into the national emergency system, so it's all coordinated.
That's really important practical info. Okay, so wrapping up this deep dive, the big takeaway seems to be that toxicity is just way more complicated than how much do they take.
That's absolutely the core message. Toxicity emerges from this complex interplay of so many factors. You've got the substances and properties, you've got the individual's unique characteristics, age, health, genetics, nutrition, and you've even got the environment playing a role. It's never just the dose in isolation.
And knowing that and knowing resources like the Toxicology Information Service exist is crucial when dealing with these situations.
Absolutely. Managing poisoning effectively needs that specialized knowledge and awareness of all these interacting pieces.
This has been really eye-opening. It just shows the incredible complexity of how our bodies deal with the chemical world around us and why reactions can be so varied. It definitely makes you rethink that old Paracelsus quote.
It does. It adds so much necessary nuance to that foundational idea. Dose matters, but it's far from the whole story.
So, thinking about all this complexity, all these individual and environmental factors influencing toxicity, it makes you wonder, doesn't it? How might things like personalized medicine treatments really tailored to your specific biology and maybe better environmental monitoring, how might those play a bigger role in actually preventing toxic effects down the road?
That's a fascinating question. The potential is certainly there as our understanding and technology advance.
Definitely something to think about. Thanks for walking us through this complex topic today.
My pleasure. It's important stuff.